Hello everyone, how are you all? Thank you so much for joining in our today's session. It's a really exciting session is going to happen today. So as you guys know that this is going to be one of the most important session for all of you guys. So we tried our best to make sure the exam correlates with how the AMC clinical exam is going to happen in the next year. But as all of you know that AMC hasn't given us yet the total format of the exam. Might be there could be some changes, but this will be the exactly how the exam is going to happen. Like there will be like 10-20% change of the stations or change of the situations, but probably this will be how your exam is going to happen. Now, if by any chance your clinical exam going to happen like online, like through Zoom session, then you have to understand that how the exam is going to happen, right? So I guess most of you has gone through the amc.org.au where they have given a little bit of explanation about how they are going to take the exam. But still they say that they will give us the more detail, especially about how they are going to take the physical examination, because that's the part where it becomes difficult to take in online sessions. Otherwise, everything is pretty easy to take because we used to take online clinical examination even before these pandemic situations comes up. So that's all right. Just the physical examinations become a little difficult. Now, where is our today's participant? Let's see if she is here. Yeah, so Dr. Anika is here. I will unmute you just in a couple of minutes, but let me just discuss with others and also you that how this exam is going to happen. So when you enter into the online session, in the AMC exam, there will be one role player who will be in a Zoom session, and you also will be on the other hand of the Zoom session. There will be an invigilator, that's not the examiner. The invigilator usually will help you to understand the situation because most of you will be new in this Zoom platforms and everything. So they will help you to give you some thorough explanation of what you can expect during the exam. And they will give you some positive findings during your examinations. They will answer your questions. They will check your ID. So everything will be done by that invigilator, but examiner will not be present during your examination. Your exam will be recorded. It's a video recording, and the video recording will be sent to a particular examiner who will judge you based on how you have done during these sessions. All right. So that's how they're going to mark you, how they are going to pass or fail you in the exam. All right. So that's one part. The second part is about the physical examination. The physical examination will be like at the moment they have given like two physical examinations. One will be 8 minute plus 2 minute outside. That means full 10-minute station. Another will be two short physical examinations divided into 5 plus 5, like 10 minutes. So that's a kind of tricky. So today we are going to do something like that. Let's see that how that goes. All right. So Dr. Anika, just to give you some update about like the sort of things, how is going to happen. So as always, the exam will be happening as a 16 stations. Two stations are non-scored. Even you or anyone in the examination will not know what are the pilot stations. So two stations will be pilot and the other 14 stations will be scored. Among that 14 station, if you pass 10 station, then you pass that exam. There is no retest for clinical examination, so you have to either pass or fail. Okay. And after that, as I said, in one of the physical examination, there will be two small physical examination in which you will be given 2 minutes outside to read the both physical examination at one go. So there is two short physical examination. You will be given 2 minutes outside to read those both physical examination in that 2 minutes time. Okay. And then When you know that what are the physical examination you are going to do in this 8 minute, you can divide your time into 4 and 4 minute. You will be given a beep at 4 minute time at that station and another beep when you finish your total 8 minute. Okay. Now during examinations, because I don't have anyone with me at the moment to help me with the timing, so I will not be able to give you that proper beep. Usually sometimes they, if in the exam they ask like take history for 6 minutes, then after 6 minutes there is usually a beeping. Like they will, it's sometimes becomes very hard to hear, but if you hear carefully or if you are not too much stressed or nervous in the examination, you will be able to hear that beeping sound. That will indicate that your 6 minute is over. You just have 2 minute time to finish your exam. In that situation, what I will do when the 2 minutes time is over, I will say move to your next task. Sometimes examiner or invigilator also do that because they know that you are under stress and they help you to move to the next task so that you can finish it in time. Okay, that's one of the thing. And yep, that's all. So let's start. Do you guys have any questions before we start the session? And just to let you know, because this is a 16 stations, and after each 4 station, there will be a 5 minute break. Normally in the examination, there will be a 10 minute break after every 4 stations. That's why it becomes a total 20 station because 4 stations are rest station and 16 are your main exam stations. In here we will give you 5 minute break just because there will be a, like, it's a long session as you can understand. So today we are going to just take the examination. Now just like AMC, we are going to hear how you have done. We will record this session, and after recording and hearing that how you have done, what are the key steps you have missed and what are the key steps you have covered, following everything, we will give you a feedback after 2 or 3 days, which will be also online session. I will give you an update after that, because today's session is going to be happen at least 180-minute session. So probably it's 3 hours session. So it's a long session. After that session, it will be really hard to give a feedback, which will not be totally appropriate. Clear? So let's start our exam. If you guys have any questions before we start, please feel free to ask it here now. And those who are joining our session through Facebook, are you guys able to hear it properly? Do you guys have any questions? I guess no. So let's unmute Dr. Anika. Hello, Dr. Anika. How you're feeling today?
Hello, doctor. Yes, I'm
Yeah.
nervous.
Yeah, it's like it's a really a good opportunity, Dr. Anika, that it's normal to be nervous, but what you are doing, it will help you immensely in the examinations because in front of, like, you got like 60 people in front of you, and you would, if you perform in front of 60 people in the exam, you just need to perform in front of 3 people. So it's just a bread and butter in the exam. So I hope you will do good. Don't worry, whatever it is, try to be calm and quiet. So always, if any stations goes wrong or if you cannot finish it in time, don't think about it, just move on. Because even sometimes if you do really good, if you miss something, examiner will pass you. That's your, always think like that, and do not think what you have done in the previous station.
Okay.
Okay, in the 10, in the 5 minute break that you are going to happen, that 5 minute is the hardest part because in your mind all the things that you have missed will come up. So try not to think at that time.
Okay.
Just pray, just say that, well, I'm going to do good, it's fine. Just say by yourself. That will increase your confidence.
Okay.
Okay.
Thank you.
And just we are starting in like couple of minutes. As I said, like, you will be given 2 minutes in the outside. When the 2 minutes is finished, I will ask you, hello doctor, can I check your ID please? You will say, yes doctor, this is my ID. All right.
Okay.
And
Yeah.
after that, I will give you the name of the patient, and then you will start your session.
Okay.
Okay. All right. And also remember, if in the task, if any time there is not specifically written that history for, like, just task is like history, diagnosis, differentials, it means that you need to take history from the patient and give diagnosis differential to the patient. If anything
Okay.
is related to examiner, it will be stated clearly in the task that you need to talk it to the examiner about it. Otherwise everything is patient.
Okay.
Good. So let's start the session. I'll give the timing. And remember, it will be a continuous session. So just after your 10 minute is over totally, then we will move to the next station, and you will not get any extra time for moving to the next station. Okay, the time will be running. So if you don't finish it when the time beeps, what will happen that your time for the next station will be gone.
Okay.
All right, so let's start our session today, guys. I hope this session goes well. So, okay, everything is ready. Your time starts. Hello, doctor. Can I check your ID, please?
Yes, doctor. This is my ID.
Well, this is your patient. Your patient name is David. You can start your session, doctor.
Okay. Thank you. Hello, David. I'm Dr. Anika, one of the GP here. So,
Hi,
how
doctor.
can I help you today?
Doctor, I'm having this diarrhea. It's totally bothering me for the last few months, and I thought initially that it was going to be clear by few days, but it's been just going on and on. I don't know that what's going on. I know I don't. I want to know the cause, doctor.
Okay. Don't worry. I'm here to help you. I'm so sorry. Are you having this diarrhea for these last few months? Okay. But don't worry. I'm here to help you out. Okay. And I will find the cause. Okay. But before that, I have to ask few more questions regarding your diarrhea. Is it okay with you?
Sure.
Okay. So can you tell me like for how long are you having this type of loose motion?
for the last 2 months, doctor.
Hello?
Last 2 months, doctor.
Hello?
Last 2 months, doctor.
Okay, last 2 months. Okay. And for how many times in a day you have to go to loo?
6 or 7 times.
6 or 7 times. And what is the like consistency? Like, is it watery?
Yep. Most of the time, this is watery, doctor.
Okay. And is there any foul smelling?
No.
Is there any blood or mucus on it?
Yes, sometimes I have seen some blood and kind of some slime in it.
Okay. And is it like hard to flush?
Yes.
Okay. And is there any greasy appearance?
Yeah, it's a greasy, doctor.
Okay. And apart from like the diarrhea, do you have any tummy pain also?
Yes, I have some tummy pain on and off.
On and off. Okay. So where is the tummy pain exactly?
It's
Which
all
side?
over my tummy, doctor.
Okay, all over your tummy. Okay. And okay. Sorry, I forgot to ask you. May I know like what is the color of this stool? Like, is it like turkey, like black in color or anything?
It's a kind of very watery diarrhea kind of things, doctor. I can't say the
No.
exact color, but yeah.
Okay. And okay. So you also told me about the tummy pain. Okay. So apart from the tummy pain, like, do you have any fever?
No,
No. Okay. Any rash all over your body?
no.
Any ulcer around your mouth or any lesion around your mouth?
Yeah, doctor, I have seen some ulcer in my mouth, and it's really painful to eat sometimes.
Okay. I'm so sorry to hear that. So for how long?
For the last 1 month.
1 month. Okay. And apart from this, have you noticed any changes in your eyes, like any redness in your eyes or any joint pain?
No,
Mhm. Okay. And how about like, may I know about your diet? Like, are you able to eat healthy, balanced diet?
I can't eat a lot at the moment. I'm feeling some loss of appetite, doctor.
Loss of appetite. Okay. And along with the loss of appetite, do you have any unwanted loss of weight?
Yeah, I think that I lost a couple of weight also, like 5 kilo in the last few months.
Okay. And how about do you have any lumps and bumps in your body?
No,
No. Okay. Like, are you on any special diet or any family
no,
member on any special diet?
no.
Okay. And how about any recent travel history?
Yeah, doctor, I traveled to uh, Africa, South Africa, about a month ago.
Okay. And have you eaten outside recently?
No,
Okay. And apart from these, how's your health in general?
yeah, apart from this, I was good, doctor.
Good. Okay. And okay. And how about do you have any medical condition that I should be aware of or taking any medications?
No, doctor, not at the moment. Just after, 1 week ago, I had some upper respiratory tract infection, and doctor prescribed me amoxicillin, I think.
Mm-hmm. So are you taking this medication
I
now?
stopped taking it. Yeah.
Okay, you stopped. So for how long ago you stopped it?
Just 2 days ago.
Just 2 days ago. Okay. And okay. And so do you smoke or do you drink alcohol or take any
No,
recreational drugs?
no,
Do you have any stress in your life or in
no.
your work? Okay. Okay. And okay, so thank you for all this information. Okay. So yeah, David, so from the history, I think there are few more possibilities of your loose motions or diarrhea. Okay. So from the history, I think you're having a conditions that we call inflammatory bowel disease. So have you heard about it?
No.
Okay, so inflammatory bowel disease is a like, it is the inflammation, that means like swelling or irritations of the lining of your gut. Okay, So that's why like you are having this like loose motion or so the tummy pain, or you also have some like loss of weight or like loss of appetite. Okay, so don't worry, it is not an uncommon condition. Okay, and there are a few more other causes of this diarrhea. Okay, it could be due to the antibiotic you took that we call antibiotic induced diarrhea, but it's like you are having this type of diarrhea for a few months. Okay, so it's unlikely because you stopped it for last 2 days. Okay, and it could be due to any other like cause that we call like irritable bowel syndrome, but you don't have any stress. Okay, so it's unlikely, and it could be due to any other disease we call it celiac disease. Okay, but it's unlikely. In this case, you are having some sensitivity of some certain foods. Okay, but you are not on any special diet, so it's unlikely. So are you so far with me?
Yes, doctor.
Okay, it could be due to any nasty growth in your tummy. Okay, so this one of the possibilities, or it could be due to any other like infections of the gut, but it's unlikely that you don't have any fever or anything. Okay, um, or you would haven't eat outside recently, so it's unlikely from that. Okay, so at the moment I have to order few more investigations, okay, to rule out the appropriate cause and to finalize our diagnosis. Okay, so we start with the basic blood investigations, like all the full blood count and all the thyroid function tests. Oh, sorry, I forgot to ask you, do you have any weather preference?
No, doctor.
Okay, and we also examine your stool that we call do the stool culture and microscope. Okay, and we also done some select serology, and most importantly, we will do the chronoscopy. Okay, that means we will induce, yeah.
Time up.
Um, okay, thank you, David.
Hello, doctor. Can I check your ID, please?
Yes, doctor, this is my ID.
Well, so this is your station. You're going to get a call from the nurse. Thank you.
Okay, thank you.
Hello, doctor. I'm the nurse here. I'm in the obstetrics ward in your hospital. I just need to talk with you about a patient.
Okay, hi, I'm Dr. Anika. So can I get your name, please?
I'm Janie, doctor.
Okay, Jenny. Okay, Jenny. Yeah, tell me more about the patient.
Doctor, I just got a patient here who just lost 1500 ml of blood after delivery, and she's still bleeding. I just don't know what to do. She just had a delivery. It was a spontaneous and vaginal delivery, but after that she just started bleeding. There is no one with me at the moment. I'm just totally helpless, doctor. What do you Can you come
Don't
over
worry.
here at the moment, please?
Yes, I'm just 5 minutes away from the obstetric ward, so I'm coming. So before I go there, I want to make sure that patient is stable right now. So can you please tell me the vital signs of my patients, like blood pressure, pulse rate, oxygen saturation, everything?
Yes, doctor. Her blood pressure is 85 by 50, pulse is 120 per minute, and saturation is 95.
Okay. Look, can you tell the patient name, please?
Her name is Sarah.
Okay, okay. So can you please put Sarah on the resuscitation table? Okay, and
Yes.
yeah, and continuously monitor her vitals. And as the blood pressure is low, please put some large IV bore cannula and first draw some blood for investigations. Okay, and then put some IV fluid. Okay, and
Okay.
okay. So after that, can I ask few more question regarding Sarah?
Yes, doctor, please.
Okay. So okay. So you tell me, like, when was the delivery happened? Like how long ago?
It's just 15 minutes ago the delivery happened, doctor.
15 minutes ago. Okay.
Yeah.
And it is like after the birth of the baby was the like bleeding start.
Yes.
Okay. And he already lost 1500 ml of blood, right?
Yes,
Okay.
doctor. It just
And
started like that.
okay. And what is the color of the bleed? Bright red.
It's Yeah. Yes, right, right.
Okay. Is there any like clot or anything?
I don't know, doctor. I can't see anything.
Okay. And was it a normal vaginal delivery?
Yes.
Okay. And was there any cut made there?
No, doctor.
Okay. And okay. And have you seen the like perineum or like also any tear or anything? Have you noticed it?
Yeah, there is no tear, doctor.
Okay. And how about can you tell me more about his pregnancy? Like, was it uneventful?
Yes, it was totally uneventful, doctor.
Okay. And what about the baby? Uh, is the
Baby's
baby
fine,
safe?
doctor.
Yeah, baby is
Yes.
fine. Okay. And may I know the birth weight of baby?
It's three about 4 kilo, doctor.
Okay. Was there any like prolonged labor or obstructed labor, anything?
No.
Okay. And can you tell me like is there any like history of any bleeding disorder or does the patient takes any blood thinning medications?
No.
Okay. Any medical condition does the patient has?
No, doctor.
Okay. Okay, so I want to move you to the patient. Okay, so can you palpate the tummy and is can you palpate the bladder? So if I want to put some catheter on it, so can you do that?
Yes, I can do that.
Okay, and as the patient is having some bleeding, so I have to you have to massage the tummy like that uterus. Can you do that? Okay. So look,
Yes.
so look, there are some causes of this condition. So it could be uterine atony, like uterine is not contracted. Okay. And it could be due to some cause, like there would be some retained product of placenta over there. Okay. So do you know like placenta is fully delivered or not?
Yes, it was delivered and it looked completely normal.
Okay. And have you checked it is like completely like all the parties present or not?
Yes.
Okay, and is due to any it's maybe due to any trauma in the birth canal. Okay, so we have to examine the perineum. So is there any tear or anything over it or not? Okay, and is due to if the patient is having any coagulation disorder or taking any blood thinning medication or has any bleeding disorder, this can also cause this. Okay, so that's why we have to look all these things. Okay, so Yeah, so and when you draw the blood, so we have to send the blood for a few more investigations, like full blood examinations, bleeding time, coagulation profiles, everything. And do you know the blood group of the patient?
It's O positive.
Oh, positive. Okay, that's good. So when I will arrive there, okay, so I will further check the vitals of my patients, okay, and I will also do the fundal massage. And is there any oxytocin over there? So can you please put oxytocin on the drip?
How much you want to give, doctor?
Um, okay. Sorry.
It's all right, doctor. I can ask someone else from here.
Okay. Okay, so yeah, oxytocin, and then I will check further check the catheter, and I will also yeah, I will also examine the patient's physical examinations, like all the systems. Okay, and then I will yeah, then I will further examine the patients, and then I will, if it's nothing like improving the patient's conditions, then we have to take the patients to the theater. Okay, and we have to examine is there any placenta, retained productive placenta is over there or not? So we have to do that. We have to check that. Okay, if there anything over there, then we have to curate test that product. Okay, and if the bleeding is doesn't stop by that, then we have to do some other procedure, like we have to do some other medications, that is prostaglandin, or we can ligate the artery of the uterus, that uterine ligation, or we can also pulse some balloon or anything to stop the bleeding. Okay, and at the last we have to like if the bleeding is not stopped and patients like family is completed, then we can do the hysterectomy. So it's in the last resource for our treatment. Okay, yeah, so
Yep.
I will do that. Okay, thank you.
Hello, doctor. Can I check your ID?
Yes, doctor, this is my ID.
So this is your patient. Your patient name is Sarah. You can start.
Okay, thank you. Hello, Sarah. I'm Dr. Anika, one of the GP here. How can I help you today?
Doctor, I just need some sick certificate. Is this headache is just bothering me, and I don't think I will be able to go to my work today. I just need to take some rest.
Okay, I'm so sorry to hear that, Sarah. So don't worry, I'm here to help you, and I will give you some SIP certificate. So before we start, I want to take some history. Okay, so is it okay with you?
Yes,
Okay, so can you tell me like for how long are you having this headache?
since last night, doctor.
Since last night. Okay, so how severe is the headache on the scale of 1 to 10, where 10 being the worst?
It's doctor 8/10, I think.
Okay, do you need any painkiller at the moment?
Yeah, I think so.
Okay, so when exactly is the pain? Like it's all over your head or it's in one side?
It's like a kind of tight band all around my head, doctor.
Okay, and does the headache goes anywhere else, like in your back or in your neck?
No, doctor.
No. Okay, and okay, and is it for the first time you're having this type of headache?
Yes, doctor. This type of headache I'm having for the first time. I used to have some headache like this kind of tight band, where I was using paracetamol and codeine for that for a couple of years, but
Mhm.
that used to help me. But now, since the last night, it's not helping me at all.
Okay, so have you taken this medication, right?
Yeah, I tried to take this medication.
Okay, so is it like continuous headache or on and off headache?
It's continuous.
Okay. And anything make it worse, like when you take some foods or anything that like
No,
make it worse? Okay.
no.
When you exposed to any bright light, that it make it worse.
Yeah, doctor. I can't usually like I can't even look at the light.
Okay. So have you seen any like flashes or any zigzag like lights in front of your eyes?
No,
Okay. And how about anything relieve this headache, like when you take rest in the dark room or
no.
anything like this? Okay. And along with this headache, like, do you have any fever?
Yeah, I'm feeling hot to touch for the last night also, doctor.
Okay. Have you measured the temperature?
No,
Okay. And along with the like hotness, do you have any chills and rigors?
no.
Okay. And is it continuous or on and off?
It's continuous, I think.
Okay. And along with the fever, do you have any rash?
No,
Okay. Any pain around your neck or any neck stiffness?
I feel a little pain in my neck. Yes,
Okay. And along with that, do you have any nausea, vomiting?
I feel nausea but not vomiting.
Okay. Do you have any weakness in your body parts or any
No,
tingling or numbness in your body parts?
no,
Okay. And do you use any spectacles?
no,
Any discharge from your eyes or ears or nose?
no,
Any recent flu-like symptoms like any runny nose, any sore throat?
no,
Any pain in your face?
no,
Have you noticed any prominent cord in your forehead?
no,
Okay. Do you have any difficulty to chewing thing or combing your hair?
no,
Okay. And yeah, how about do you have any like headache during the early morning?
no,
Any lumps and bumps in your body or any unwanted weight loss?
no,
Any medical condition that I should be aware of? Taking any medications?
mm, no,
Okay.
doctor.
Okay. Do you have any stress in your life?
Yeah, I do have some stress in my life. I'm doing the work, and I recently got promoted, and there is a lot of stress.
Okay. Okay. And do you smoke or do you drink alcohol?
No,
Okay. So thank you, Sarah, for all this information. So I need to talk to my examiner. Okay. So dear examiner, may I know the general appearance of my patient? Is there any payload?
patient seems restless,
Okay.
there is
And
no payload.
okay. And may I know the vital signs of my patients? BP pulse rate.
Blood pressure 120/80, pulse rate is 90.
Okay, and I would like to do head to toe examinations. So on the head, on the like inspection and palpation of the head, is there any finding over there?
No,
Okay, and on the eye examination, I would like to know the visual acuity, visual field, and is there any fundoscopy available?
no fundoscopy not available, and other eye examinations are normal.
Okay, and on ENT examination, is everything normal?
Yes, everything normal in the ENT.
Okay, and all over the body, is there any rash?
No rash,
Okay, any lymphadenopathy?
no lymphadenopathy.
Okay, all the other system examination is normal, like respiratory, Cvs, and abdominal.
Respiratory Cvs abdomen is normal.
Okay, is there any office test available?
No.
Sorry, examiner, I forgot to ask, is there neurological examination available?
Yes, what you are looking for?
I want to do the like tone power reflexes of all the limbs.
Tone power reflex are normal.
Okay. Okay, and sensory examination is also normal.
Yes.
Okay, so thank you, examiner. Okay,
Thank
so
you.
Sarah, I have taken your history and I have examined you. Okay, so on the history and examinations finding, okay, I haven't found anything regarding sorry from the based on the history and examinations. I think you are having this headache. Most probably, we call it like tension headache. Okay, so have you heard about it?
No, doctor.
Okay, so what happened? Like you tell me that you're having some stress in your workplace. Okay, so this is stress, like our body and mind is like connected to each other. Okay, so what happened in that case? So whenever you have any stress in your life, okay, so there are some symptoms you feel in your body. Okay, in your case, you are having this headache due to this stress. Okay,
Time up.
and it could be.
Time up. Hello, doctor. Can I check your ID, please?
Yes, this is my ID.
So this is your patient. Your patient name is Mary. you can start. If you have any confusion, you can ask me anytime.
Okay, thank you. Mm, Hi, Mary. I'm Dr. Anna, one of the medical officer here. So I can understand from the note that you are having some pins and needle sensation on your right arm, right?
Yes,
Okay.
doctor.
So due to that, I have to examine your hand. Okay. So my examinations will include look at your hand, then feel your hand, and then we have do some movements and do some special test. Okay. So is it okay with you?
Yes, doctor.
So during my examinations, I will talk to my examiner and I will give some comment on your hand. Okay. So can you please put your hand on the pillow?
Yes, doctor.
Okay. Okay. So I'm starting my examination. So on inspections of the hand, I'm looking for any scar mark, any swelling, um, any deformity. So on the hand there is band in the like fourth and fifth finger, and I also looking for any like nodules for any like hardened nodules and any rheumatoid arthritis nodules or any like swan neck deformity, z deformity, so it's not present. And I also looking for any like wasting. Okay. So now I will wanna look the elbow joint also for any nodules or any psoriatic patches. And then
Excellent.
I will okay, then I will palpate the hand. So first I will check the temperature. Okay.
Normal
And
both
then
side.
okay, then I will check the capillary fill time. So is it normal?
Normal.
Okay. Then I will check the palm. So is it like dry or is it sweaty?
Nope.
Okay. And I also looking for any wasting. Okay. So now I also look for any tenderness. So I'm palpating the joints. So the all the pharyngeal joint, metacarpopharyngeal joints, and the wrist joint for any tenderness.
No tenderness.
Okay. Now I'm going to check the movements. Okay. So I'm doing starting with the wrist movement. So flexion, extension. Okay.
Flexion extension
Um,
of the wrist is normal.
okay. Now I'm moved to the finger. So I'm checking the extension and flexion of the finger also. Okay.
Extension flexion is normal.
Now I'm checking the movement of the thumb, like flexion, extension, abduction, adduction.
Thumb movement normal.
Okay. Now I want to check the power. So I'm checking the power of the wrist movements. So okay. So can you do
Wrist
flexion and
power movement.
okay.
Wrist
And
power is 5/5.
okay. And I also wanna check the power of the fingers.
Okay, so you have loss of power in fourth and fifth finger. Mainly flexion is 0/5.
Okay. And also
Sorry,
the thumb.
extension is 0/5. Others are all normal.
Okay. And all the thumb power, abduction, adductions, everything. It's normal.
Thumb power is 5/5 in all directions.
Okay, so now I am going to check the sensation. So I'm going to check the sensations over the all the fingers.
There is loss of sensation in fourth and fifth finger.
Okay, now I'm going to check the reflexes like supinator, biceps, triceps. Is everything normal?
Reflex present.
Okay, and is there any? Okay, I'm going to do the special test like tinel test and panel test, prayer signs. Everything is normal.
Please ask direct the patient as you want to do.
Okay, so I will tap on your wrist area. Okay, so I'm tapping the wrist area. So is there any findings?
No, no tinel test is negative in the wrist.
Okay, so can you put your hand together? Do you have any pain?
Yes, doctor. No.
Okay, okay, and okay, and now I'm going to do the function assessment of my patient. Like, is there any like, yeah? Can you please hold my finger and like grip my
Yes.
finger, and I will, yeah,
The gripping power is lost.
gripping power is lost. Okay, and so can you please do like this, like open the, like holding the key and opening the lock?
It's impaired, but patient is able to do most of it.
Okay, and can you pick up the coin?
Yes.
Okay, and can you hold the pen and write your name?
Yes, patient is able to do that.
Okay, so thank you for Mary for letting me do all the investigations. Okay, so the examiner also do the on joint above the elbow joint to better assess my patient. Okay, so
Normal.
from the, yeah, from the examinations, I think what you are having is, we called it claw hand. So do you know what is it?
No.
So there are some nerves that's supplying the hands. This nerve, we are call it like ulnar nerve. Okay, so in your case, this nerve is like compressed in somewhere. So that's why you are having this like tingling and numbness sensation, most probably in your fourth and fifth finger, because this nerve is supplying in that area. Okay, so that's why maybe you are having this condition. Okay, or it could be due to any any condition that we call cervical spondylosis, that is affecting the neck area, bone of the neck area. So at the bone of the neck area, it become inflamed. So in that case, it also can compress the nerve and can cause this type of symptoms. Okay, so are you with me so far?
Yes, doctor. Yep.
Or it could be due to any other conditions, like it could be due to any trauma or any fall or any like fractures, that also can has this condition. Or it could be due to any like degenerative conditions that we call like arthritis, that is inflammations of the joints, that it could be like osteoarthritis or rheumatoid arthritis or psoriatic arthritis. Okay, so but you doesn't have any like features, any nodules or any deformities apart from that, so that's why it's unlikely. Okay, so now we have
Yep.
to do some investigations, and yeah, for our like, and we have to manage the condition. Okay,
Time up. So 5 minute break. All right, so your 5 minutes is up.
Okay.
Start. Hello, doctor. Can I take your ID?
Yes, this is my ID.
So this is your patient. Your patient name is Kate. You can start.
Hello, Kate. I'm Dr. Anika. I will be your GP today. Okay, so
Hi, doctor.
hi. How are you feeling today?
Yeah, I'm okay, doctor. I just need you to give me some temazepam script because I can't sleep without it, and then I'll be happy to go home.
Okay, okay. So before we start, I want to make sure that reassure that everything we discuss here will be private and confidential unless I have concern for you or other. So is it okay with you?
Yes, doctor.
Okay. So I can understand that you want to take the script for tamazepam, right? Because you're having sleeping problems, right?
That's right.
Okay.
Yeah,
So can you tell me more about it? Like for how long are you having the sleeping problems?
it's been a year, doctor.
It's been a year. Okay. So
Yeah.
what type of sleeping problem is it? Like are you
It's
um,
like I have difficulty like I can't get into sleep sometimes, and even I can't get into the sleep, and then I wake up early in the morning. So it's kind of disrupted sleep, and I feel very tired in the morning. I have to sleep all the day.
okay, okay. I'm so sorry uh, for your like feeling this way. Okay. So are you taking the tamazepam, right? So it's for last 1 year, right?
Yeah,
Okay. So who prescribed it for you?
my other GP.
Your other GP. Okay. So
Yeah,
it's due to the sleeping problem, right?
yeah.
Okay. So have you like recently increased the dose of temazepam to get the same effect as before?
No,
No. Okay. So are you taking it every day, like every night?
yeah. I take one tablet every night.
Okay. And what happened when you don't take this medication?
I feel difficulty with sleeping. That means I can't get into sleep. That's the only
Okay.
problem.
Okay. Do you think that you are like dependent on this medicine?
I don't know, doctor. I don't think so.
Okay. And when are you taking these medications? Are you having any side effects from it? Like, do you feel any like anxiety or any shaking of your
No,
hand or anything? Okay. Any
no,
nausea, vomiting? Okay.
no.
So, from where are you getting this like script to get this temazepam? Because you are taking it for too long.
Ah, doctor, it's my other GP. I stopped getting into her because she doesn't want to give me any more script, and I don't
Mm-hmm.
feel like she's helping me anymore. So previously, she used to give it to me, and I used to buy it from a pharmacy.
Okay, okay, understand. And can I more talk about your mood? Like, how's your mood nowadays?
I don't feel good, doctor. I'm very upset about everything.
Upset. Okay, so for how long?
It's been going on for a long, long time. Like for the 1 year I've been here, I've been like this. Like, but for the last 2 months, I think it's getting worse, and I feel very difficulty with sleeping, and I
Mhm.
can't concentrate at anything. So it's become very
Mhm.
hard nowadays.
Okay, I'm so sorry to hear that. So along with that, do you have any unwanted loss of weight or loss of appetite?
Yeah,
Do you think that are you slow down on things?
yeah. I'm very slow. I can't do anything.
Okay. When people is having this difficult time, people can try to like harm themselves or harms other or like they thinking life is not worth living. So does this happen to you ever?
No, doctor. Currently, I don't want to do anything like that.
Okay. So I want to ask few more screening questions. So it is my routine question. So is it okay with you?
Yeah.
Okay. So have you heard, see, or like feel things when nobody is around you?
No,
Okay. Do you think that someone is trying to harm you or someone is spying on you?
no,
Okay. Do you think that your idea is being broadcasted to TV, radio?
no,
Okay. Do you feel guilty about anything?
No, doctor, I don't feel guilty, but I feel really upset because my parents, they don't think I'm worthy of anything.
Okay. So, why they think like this?
I don't know, maybe because I'm very slow, maybe actually I'm worthless, that's why.
Okay. So, are you really like worry a lot for like everything?
No,
No. Okay. And how about do you have any stress in your life?
I have a lot of stress. My parents, they are very strict, and they 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 don't let me allow to share anything with them, and they
Mm-hmm.
have always like a very great expectations from me, and most importantly, they don't even care about my feelings. So yeah, I'm under stress.
Okay. And how about are you enjoy your hobbies?
No, I don't enjoy anything.
Do you have friends? Do you like go out with your friends?
No, I don't.
Okay. And do you smoke or do you drink alcohol or take any recreational drugs?
No,
No. Okay. Have you ever been diagnosed with any psychiatric illness in the past?
no, doctor. I haven't gone into any psychiatrist actually.
Okay. Any family history of that?
No,
No. Okay. Okay. So thank you for all this information. Okay. So I think from the history, I think you are having this sleeping problem. Okay. So it's because like you are feeling like upset and low, and you are also having some stress in your life. Okay. So altogether, I think you are a bit depressed right now. Okay. So that's why you are having this. Okay. Or it could be due to any any we call it like anxiety, sorry, adjustment disorder. Okay. Due to that, you are having some issues with your family. Okay, so that's why you're having this type of problem. Okay. Or it could be due to any like anxiety, that you call like generalized anxiety disorder. Okay. Like patient is like people is more worrying about things. Okay. In that case, they may have this type of problem. Okay. Or it could be due to if you are taking any substance, that we call like substance abuse. Okay. Or it could be due to if you are like you
I'm a,
already take these medications. Okay.
Hi, doctor. Can I check your ID, please?
Yes, this is my ID.
So this is your patient. This actually the nurse wants to talk with you. The nurse name is Beth. You can start.
Okay. Hi, Beth. I'm Dr. Anika. So, can you tell me how can I help you today?
Hi, doctor. I'm Beth. I'm one of the nurse here. Actually, I wanted to talk with you about one of the neonate who just born overnight. The night doctor actually knows about this patient much more detail, and he also inserted a NG tube last night. But
Mhm.
what I'm more concerned about is that the child is just vomiting everything, whatever the mom is given. Mainly, whenever mom is trying to breastfeed, child is vomiting everything out. I don't think it's a good sign, doctor.
Okay, don't worry. I'm here to help you. Okay. So, can you tell me more details about the vomiting? Like how many episodes have the child had?
It's every time, doctor. Every time. It's been 10, 12 episodes.
Okay. And what is the content of the vomiters?
It's like all the breast milk is whitish in color.
Whitish in color. Okay. Is there any blood or any greenish color?
No,
Okay. And how about is there any foul smelling over there?
no,
Okay. And okay. And how about was the baby when was the baby was born? Last night?
yes,
Okay. And is he like after birth? Does he pass his first poo?
yes, doctor.
Okay. And how about his like have you noticed any like fever or any rash?
No fever, no rash.
Any distension of the tummy?
Yes, the tummy seems like quite distended to me.
Okay. And after the birth, the mother is tried to breastfeed, and what happened?
And just after like whenever the mom is giving breast milk, the child is puking everything.
Okay. And how about his pee and poo?
It's very very low, doctor. I have just changed one nappy so far.
Okay. And was it smelly?
No, I don't think so.
There any okay dark color of urine? Have you noticed?
It's yeah, I'm not totally sure, doctor, but yeah, it's a quite
Okay.
dark, I would say.
And how was the mom's pregnancy? Like, was it uneventful?
Yeah.
Does the mother take any medication during pregnancy?
No.
Okay, and how about the birth? Is it normal vaginal delivery? Was there any complications?
Yeah, it was normal and there was no complication, doctor.
Okay, and after birth, was the baby upgrade score?
The upgrade score was 7.
Okay, and does baby needs any special care after that?
No.
Okay, and was the baby received his first vaccinations?
Yeah.
Okay, and you told me about the NG tube, and does the
Yes.
the last doctor is like successful to put the NG tube?
No, doctor. The doctor was not able to like do that. It was something coiling, as he said.
Okay, okay, okay. So thank you for all this information. I would like to ask you more things from my examiner. Um,
Yeah.
okay. So the examiner, may I know the general appearance of my patient? Is the patient drowsy, lethargic?
Child seems drowsy.
Okay. Is there any dehydration, any pallor?
Yeah, there is signs of dehydration, moderate sign of dehydration, positive.
Okay. And may I know the vital signs of my patient?
Vitals are stable.
Okay. And I would like you to head to the examinations, more focused on the abdomen. So on inspection of the abdomen, is the abdomen distended?
Yes.
Is it soft, non-tender, any mass on palpation?
No mass on palpation, and it's soft but distended, non-tender.
Okay. Is there test feeding done?
No.
Okay. And I would like to, with the with the patient mom consent, I'd like to do the genital examinations and the pararectal examination. So, is there any finding over there?
No,
Okay. Is there any office test available?
no.
Okay. And I would like to ask, is there any like any X-ray or any ultrasound of the tummy available?
Yeah, this is the X-ray of the chest.
Any blood test available?
No blood test so far.
So thank you, examiner. So yes, babe. So from the history, and I have examined your baby, and we already done the X-ray. So you can see here the angioTube is coiled over here. You can see on the middle of the chest. Okay. So in that conditions, we call it like esophageal atresia. Okay. So that means the food pipe is absent or blocked. Okay. So that's why the when we pass the adjective, it's not goes down, and that's why baby is vomiting in every feed. Okay. It could be due to any other conditions that we call like transesophageal fistula. Okay, there would be connection between the windpipe and food pipe. Okay, or it could be due to any other conditions that we call duodenal atresia. That means a small gut could be absent or blocked. Okay, but it's unlikely because the vomitus is greenish and baby passed the first poo. Or it could be due to any other like pyloric stenosis. There would be narrowing of the on of the like lower part of the stoma, or it could be due to any reflux. Okay, but it's unlikely from the history. And it could be due to any like intestinal obstruction. There would be obstruction in the other part of the gut, or any malrotation of the gut, or any like volvulus. Anything can cause this type of vomiting in a newborn. Okay, so we have to do further investigations, and we have to manage this baby's condition because baby is vomiting. Okay, so are you so far with me?
Yes, doctor.
Okay, thank you.
Thank you, doctor. So you have 50 seconds in your time. If you want, you can go outside or you can stay here. Or if you want to talk anything with the nurse, you can also do that.
Okay.
Your next station is started. Hello, doctor. Can I take your ID, please?
Yeah, this is my ID.
All right. So this is your patient. Your patient name is Maria. You can start.
Maria. Okay. Hi, Maria. I'm Dr. Anika. I will be your GP today. Okay. So,
Hi,
what's
doctor.
bringing you here today?
Doctor, I'm just feeling really tired for these last 2 weeks, and it's just like aching pain all over my body, and I just feel like I need to sleep a lot.
Okay. So, it's for last 2 days, 2 weeks only, right?
Yes, doctor.
Before that, everything was normal.
Yeah.
Okay. Don't worry. I'm here to help you out with this condition. So, first of all, we have to find out the cause why you are feeling this way. So, I have to ask you more questions. Okay. So,
Yeah.
okay. So, can you tell me, like, do you have any weather preference?
No.
Any weight changes unintentionally?
No. No.
Okay. And have you noticed any lumps and bumps in your body?
No.
Okay. And have you noticed any change in the skin coloration of your body? Like any yellowish or any pigmentation?
No.
Okay. Have you had any recent dental procedure?
No, doctor.
No. Okay. And how about do you have any fever or any rash in your body?
No.
Any recent travel history?
No, doctor.
Any tattooing or body piercing?
No.
Okay. Do you have any like any short of breath or any funny racing of heart?
No.
Do you feel dizzy?
No.
Okay. And how about uh, do you okay? More tell me more about your sleep. Like, are you able to sleep well during last 2 weeks?
No, doctor. Actually, I can't sleep because like I'm going to have my semester final if of year
Mm-hmm.
12 in the next 2 weeks time. So I
Mm-hmm.
have to read a lot. I used to like stay awake in the night and read all these things. So that's why I'm not getting a lot of sleeping for these 2 weeks.
Okay. I can imagine that it's very hard time for you, right? Okay.
Yeah.
So so during that, like you won't be able to sleep at night, right? So that's why you feel like sleep during the daytime, right?
Yeah, doctor. That's why I feel sleepy all the time.
Okay. Do you know, like, has anyone noticed that you are snoring during the sleep?
No.
No. Okay. So, do you have any like medical conditions that I should be aware of or taking any medications?
No, doctor.
Okay. So, do you have any may I know about your mood? Like, do you feel low nowadays, or do you have any stress, anything like this?
No, doctor. My mood is fine. It's just because I'm stressed about the exam.
Okay. Okay. And how about sorry, but I have to ask you more private and sensitive question. Is it okay?
Yeah.
Okay. Have you started your period?
Yes, doctor.
Okay. So, is it regular and average in cycles?
Yeah.
Okay. And do you bleed heavily?
No.
No. Okay. So that's fine. Okay. So, do you smoke or drink alcohol?
No.
Okay. So that's fine. And how is the home situation? Everything good?
Yeah, everything is fine.
Okay. So, yeah, thank you for all these informations. Okay. So, look, Jenny, from the history, what I have found that there are many causes of this tiredness. Okay. But you told me that you are having some like sleep deprivation, like we call it like sleep deprivation. Okay, due to you're having some lacking of sleep during the last 2 weeks because you're having some like assessment coming in couple of days, right?
Yeah.
Okay. So that's why you won't be able to sleep properly. So that's why you are having this tiredness due to lack of sleep that we call sleep deprivation. Okay. Or it could be due to any other conditions that we call obstructive sleep apnea. There would be some obstructions when you are sleeping, and that cause some lack of oxygen to the brain. But it's unlikely because anyone doesn't notice any snoring about you. Okay. Or it could be due to any like depression, low mood. Okay. Or it could be due to any hormonal imbalance that we call like thyroid disorders. Okay. Or
Yeah.
it could be due to any any other genetic causes that we call hemochromatosis, but it doesn't have any pigmentations or anything. Okay. Or it could be due to any infections. Okay, but you doesn't have any fever, any rash, or you haven't does any tattooing. Like it could be due to any like tuberculosis, hepatitis, all type of infection that cause this type of tiredness. Okay.
Yeah.
So are you with me so far?
Yes, doctor.
Okay. And it could be due to if you have any medical conditions like any diabetics, or if you are taking any medications that also can adversely affect this tiredness. Or yeah, and it could be due to at the least any nasty growth, but regarding your age and you doesn't have any weight loss or any lumps and bumps, so again it's unlikely. Okay. So now these are a few things. Yeah, this could be the cause, but most likely the sleep deprivation. Okay. So yeah, so for this I can give you some reading material regarding these things. Okay. And we can manage this condition. Okay. So are you
Yeah.
happy with that? That sounds good to you?
Yeah, doctor, I think so. Yeah, that's fine.
Okay.
So you have 1 minute time. If you want to stay, you can stay, or you can go outside, or you can talk more with your patient.
Okay. Okay, I will go outside.
Okay.
Okay, thank you.
Next station. Hi, doctor. Can I check your ID, please?
Oh, yes, this is my ID.
So this is your patient. Your patient name is Janie. You can start.
Mm. Hi, Jenny. This is Dr. Anika, one of the GP here. So, how can I help you today?
Doctor, I'm here because I think I need your help because it's been more than a year we have been trying to get a
Mm-hmm.
baby, but unfortunately we are not able to do that. I think that there is some problem within me. That's why that's happening.
Okay, I can understand your concern, and don't blame to yourself. Okay, I'm here to help you in the best possible way. Okay, so before we start, let me tell you that some of my question would be private and sensitive. Okay, but it would be confidential. Okay, so is it okay with you?
Yeah, doctor.
Okay. So, can you tell me like more about it? Like you are trying for last 1 year, right?
Yeah.
So, can I know about your period? So, is your period regular?
Yes, doctor. It's been regular for whole my life.
Okay. Like how long it stay and how many days apart you bleed?
So normally it stays for 2 to 7 days, and yeah, so like bleeding is mainly for 2 3 days. Then it becomes normal.
Okay. And during this bleeding, do you have any heavy bleeding or passage of any clots?
No,
In any bleeding in between your periods?
no,
Any pain during your periods?
no.
Okay. And are you sexually active?
Yes, doctor.
Okay. Do you have any stable partner?
Yes, doctor. Me and my partner has been trying for the last 1 year.
Okay. So so may I know like do you know about the fertile period?
No, doctor. What is that?
Okay, I will explain to you later. Okay. So
Yeah, sure.
this is the period that will there will be high chance to get pregnant. Okay. So can you tell me more about your like sexual life? Like are you like how many times a week are you like going to do the sexual intercourse?
Doctor, it's a little bit of complicated because my husband is a businessman and he needs to go to the interstate, like
Mm-hmm.
like every now and then. So we didn't get
Mm-hmm.
enough time to do the intercourse. So it's been like one or two times a month.
Okay, 1 or 2 times a month. Okay. And apart from this, have you or your partner ever been diagnosed with any sexual transmitted disease?
No,
Okay. And are you are you on any like contraception before, like trying
I
this
used
pregnancy?
to take OCP, but I stopped it for 2 years ago.
Okay. And how about have you had any like pregnancies in the past or any miscarriages?
No,
No. Have you had any surgery in your down below or in your like wombs, anything?
no, doctor.
Okay. And how about your health? Like, do you have any weather preference or any weather change, like any weight changes?
No,
Okay. And how about have you noticed any excessive hair growth in your face or any acne problem?
no,
Do you have any headache or any blurring of visions?
no,
Or any milky discharge from your breast?
no.
Have you noticed any hot flashes, any mood swings?
No, doctor.
Okay. And are you able to do any exercise?
Yeah, I do exercise.
Okay. And for like how many hours in a
It's
week?
just lot like 30 minutes most of the time of
Okay.
the week.
Okay. And by any chance, are you doing any binge eating or anything?
No,
Okay. And how about your pee and poo?
it's all good.
Do you have any rash in your body, any fevers,
No,
any stress in your life?
no,
Do you smoke or do you drink alcohol?
no,
Okay. Any family history of any similar problem, like regarding fertility?
no, doctor.
Okay. So thank you. So I would like to examine you. Okay. So they examine. Okay. No examination. Okay. Is this from the
From
examiner?
examiner. So
Yeah.
all the physical examinations are normal, So you just need to do the pelvic examination. You can ask it to the examiner.
Okay, so with the patient consent and with the presence of the chaperone, I would like to do the pelvic examination. So I would like to do for inspection first. So is there any rash, any vesicles, any discharge?
Nope.
Okay, and on speculum examination, is there any is the cervix looks healthy?
Yes.
Okay, and on bimanual examination, is there like I'd like to know the uterine size, mobility, tenderness,
Uterine size is normal and mobile, no tenderness.
and cervical motion, tenderness, or any adnexal mass?
Negative.
Okay, any office test available?
No.
Okay, so thank you, examiner. So, yes, Jenny. So I have taken history and I have examined you. So I haven't find anything abnormal, apart from like you haven't gone through enough sexual intercourse, because you told me that your husband is leaving interested, right?
Yes.
Okay, so that would be the cause, because the frequent yeah, you have to go through at least 2 to 3 times a week, like the sexual intercourse things. Okay, and because there would be high chances if you are doing this sexual intercourse like every weeks at least 2 to 3 times. Okay, and there will be some like as I told you, like fertile period, like there are some time there will be increased chance of being pregnant. Okay, so in the pharmacy there is some ovulation kit. Okay, so you can buy and you can test that for ovulation. Okay, and you can do this sexual intercourse during that time. Okay, and if you want, I can arrange some meeting with your husband. Okay, and there would be some another cause like some hormonal imbalance and anything so that's why we have to do some investigations to look everything is perfect or not. Okay, so in that case we have to do some blood investigations and some hormones, especially the progesterone hormones. So we will want to do on 21st day after your periods. Okay, and we will do some other hormones like sexual hormones like estrogen, progesterone, follicular stimulating hormone, luteinizing hormone, everything. Okay, and we have to do some ultrasound, okay, of your tummy and the transvaginal ultrasound to look everything normal over there. And we can do also the basic blood test to see the hormones that we call thyroid and prolactin, because this hormone imbalance can cause this subfertility. Okay, so are you with me so far?
Yes, doctor.
Okay, and after that, after yeah,
Time up.
okay, hello, yeah. So yeah, so at that time,
Time up, doctor.
okay.
5 minute break. Hi, doctor. So this is your station. Hi, doctor. Can I check your ID, please?
Yes, this is Marty.
So this is your patient. Your patient name is David. You can start.
Okay. Hello, David. I'm Dr. Anika, one of the medical officer here. Okay. So,
Yes.
David, before we start, I want
Yes.
to.
Yeah. Yeah. I'm coming, doctor. Yeah, President. Yes. 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 Yeah. Yeah. I can hear you, President. It's just little blurry on your phone. Yeah. Can you hear me? Just wait for a moment. I just need to go outside. Yeah. Yeah.
Oh,
Yeah. What do you want me to do? Yes. Yes. Yeah. I can do that for you. That's fine. Totally. Yes. I think that you choose me like the right person. Yes. Yeah. Yeah. I'll be there. When you want me to do that in 1 hour? Yeah, that's fine. I'll be there.
oh,
Yes. Okay.
okay, David. I can
Yeah, I'm
understand.
coming. I'm coming.
Okay. Okay, David, I can understand that you are in bit rush. Okay. So I want to make sure that like what we discuss here will be private and confidential. Okay. And it will be between us. And yeah, unless
Doctor,
I
I
have
just
to
need to go. I'm really busy at the moment. The world needs me, and the world where is coming. President needs me to do something very important.
Mhm.
If you don't mind, I just need to go.
Okay, I can understand that you are in bit rush at the moment, but can you please give me a few more minutes? Like, can you have a seat and we just can talk, please? I won't take much
Yeah.
time, I promise.
Yeah. Yeah. What do you want to know, doctor? Just
Okay.
yeah.
Okay, I can understand that you are talking with the president, right?
Yeah.
So,
Yeah.
can you tell me like more about it?
what what do you want? I say that the world is in danger. There is a world where is coming up, and I need to save the world.
Okay. So you think that you have a special power, right?
Yes, I have the power like Voldemort, and I can only save this world, and that's why president chose me. As you can see, just I got a call from the president.
Okay. Okay. So does the president come on to do you anything?
Not specifically, he just want me to save the world. That's all. I know
Okay.
what I have to do.
Okay. And how about are you like able to see the president now?
No, he doesn't come forward. He's special, like he just talked with me.
Yeah, I can understand that. So apart from this, like, do you think that like someone is trying to harm you or someone spying on you?
No.
Yeah. And
Who
how
can
about
harm
you?
me? Who can? There is no one. There is no one who can harm me.
Okay. And do you think that someone is like trying to stolen your thought from your mind or putting some thought into your mind?
No, no one can do that.
Or your thought is being broadcasted to TV, radio?
I don't think so.
Okay. Do you think that you are special or everyone is talking about you or everyone action is towards you?
Yeah, doctor, I think like people are jealous about me because they know that the president is talking with me only. So they think that I'm very special and they're just jealous about me. And I think that all of them are talking about me.
Okay. Okay. So apart from this, like how is your mood nowadays? Do you feel high, low, anything?
I'm okay.
Okay. Do you have any problem with your sleep, appetite, or concentration?
No, I'm okay. Yeah.
Okay. And when people have some stress or anything in life, they try to harm themselves or harm other, or yeah, is anything happen to you?
No, I want to save the world. Why I will harm myself?
Okay. Okay. And may I know about like whom do you live with?
I don't live with anyone. I live alone.
Okay. And do you have any friends?
No, no, no one wants to be friends with me because they know I'm very much special than them.
Okay. And are you okay? And do you smoke or do you drink alcohol?
No,
Do you take any recreational drugs by any chance?
no,
Okay. Do you think that you need any medical help?
no. Then why I would need medical help? I have the power to save the world.
Okay. Yeah, I understand that you stopped the medication. Like
Yeah.
you stopped it by yourself or anyone told you to do that?
No, no. I just don't need it, doctor.
Okay. I have to ask few more screening question. Is it okay with you?
Yeah.
Okay. If is any fire in this room, what would you do?
There is fire in this room. Where is the fire?
No, just like assume that is there is any fire.
Yeah, yeah. I think I should run.
Okay, that's good. And do you know where you are now, and who I am?
Yeah, you are the doctor, and you are killing my time.
Okay. And okay, so thank you for all this information. Okay, so David, please just wait for a minute. I would like to talk to my examiner. Okay. So,
Mhm.
dear examiner, I'd like to present the mentalist examinations of my patient, David, 25-year-old student, having some behavior complaint. So, on the examination, on appearance, okay, on appearance, okay, the patient is appropriately wearing so groom well and what appropriately wear dress to the occasion, and the body posture is looking good, and the patient was not very cooperative with me, but patient is not hostile to the doctor. And regarding the speech rate rhythm is normal, and the mood according to the patient it's normal, and the effect water observed it's congruent with the mood. And the thought form is okay, there is no losing association, and there is no flight of ideas. And the thought content, there is some delusion of grandiosity, and presence. And on perception, there are some auditory hallucination but no visual hallucination or illusion. And regarding the insight is poor and the judgment is intact, and patient is oriented to the place and person. And there is no risk of there is no risk of suicide, but there is some risk because patient is having some hallucination. And the history is not too reliable for to me. I would like to take some collateral history from the friends and family. Okay. And so look, David, I have examined you. So from that, I think you are having some conditions. We call it psychosis, and you already has diagnosed with like some disorder. So it could be due to relapse of this. So we called it like relapse of schizophrenia. Okay. So are you getting me?
Yes.
Okay, so it's just on type of like, okay,
Time up.
and it could be due to any other cause like any okay,
Time up.
yeah.
So when you finish with one station, there is two question in here. Just
Mhm.
ask me. I will move to the next.
Okay, so it's okay, 4 minute duration. Okay, yeah.
Hello, doctor. Can I check your ID, please?
Yes, this is my ID.
So this is your patient. Patient name is John. You can start.
Okay. Hi, John. I'm Dr. Anika, one of the medical officer here. So I can understand that you're having some problem with your face, right?
Yes,
Don't
doctor.
worry. I'm here to look at your face. Okay. So I'm here to examine your face. So I will do some like special test. Okay, and I will instruct. Sorry, yeah, I will instruct you to do some movement. Okay. So is it okay with you?
Yes, doctor.
Okay, so can you please sit on that okay chair? Okay, and
Okay.
okay, so first, can you please look up?
Yes.
Okay, and yeah, can you please
You have to give
uh,
the running commentary.
okay, okay. So yes, there is no loss of wrinkling when patient is look up. Okay, so can you please close your eyes and I will try to open it. So don't let me try to open it. Okay, okay. So patients okay, left side eye is won't be able to close properly. Okay, so and next I would like you to make a whistle, like for your okay. Patient is only able to do that. Okay. Now, can you please blow your cheek, and I will try to pop it. So don't let me pop it. Okay.
The same picture.
Okay. Okay. Patient won't be able to do that. Okay. So I want to ask few more question. Okay. So can you tell me, like, do you have any sensation lost of your taste from the tongue?
No, doctor.
Okay.
No.
And do you think that are you hearing more? Are you hearing sounds more loudly nowadays?
No.
Okay. And I also want to examine the ear for any rash or any vesicles.
Normal. Negative.
Okay. Okay. So thank you. So yes. So from the examinations, I think. Okay. Yeah. What I have found that you are having some conditions we called it Bell's palsy. Okay, so it is one of the nerve that supplies the face. So it's like there are some complications over the nerve. So that's why you are having these complications with your face. Okay, so this conditions we call it Bell's palsy, or it could be due to any infections that is affects your ear. That could be herpes infection that can also cause this impairment. Okay, or it could be due to any nasty growth in your gland. One of the gland we call it parotid gland, that we call like parotid carcinoma, or any benign growth over there that we call parotid adenoma. Okay, but it's unlikely from the examinations. Okay, or it could be due to any stroke. Okay, there would be some damage over your brain, like blood supply, that can also cause this type of symptoms, but it's unlikely. Okay.
Okay.
Okay, thank you.
This patient name is David. You can start.
Okay, start. Yeah, David, I'm Dr. Anika, one of the medical officer here. So I can understand that you had some bike accident, right? Okay, you also had some
Yes,
pain on
doctor.
the shoulder. Okay,
Yes,
so we
doctor.
have done some X-ray. Okay, so you can see here. So you can see here, this is like whitish part. You can see it's a bone, and this is the blackish part is the ear. Okay, so if you look here on your in between the shoulder and the rib cage, so there are the bone, we call it clavicle. So there is some fracture over there, you can see here is broken. Okay,
Yes, doctor.
so from that, yeah, we can tell you that it's like a clavicular fracture. Okay, that's you are having from that accident. Okay, so in this there is some implication or complications from this condition. Like it can be like it's very painful, I know that, and it can be not united again. Okay, or it can cause some lacking of blood supply over that area. Okay, but it's good there you here we can manage this type of complications. Okay, so I have to examine you further. Okay.
Yes, okay.
Um, I want to look for any yeah. Okay. There is no scar mark, no swelling, no deformity, no nodules. There, I think the clavicle is bit. I think it's broken, so it's like a bit upside. Okay, and I would like to now palpate. So palpate the temperature first. So is there any raised temperature?
Normal.
Okay, and I would like to palpate the joint. So is it like painful or
Which
tenderness
joint you are
present?
doing?
The clavicular joint and all the lines, the sternoclavicular, acromioclavicular, shoulder.
Patient feels tenderness in the middle third of the clavicle.
Okay, middle third of the clavicle. Okay, so I'd like to do some movement of the shoulder uh, to make sure the
Shoulder
shoulder.
movement is not possible because patient is very much painful, so he doesn't want to do any movement in any direction.
Okay, and okay, and I want to also check the capillary refill time.
Normal.
Okay, and also check the Mm, okay. And neurological, like tone, power, reflexes of the shoulder.
Tone power reflex is normal.
Okay. Okay. And I would like to do the spatial test, like empty can test and the near test.
Patient is not doing any of the test because patient shoulder is painful.
Okay. 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 Thank you.
Thank you, doctor. You have 55 seconds in your hand. If you want to add anything, you can add at this time, or you can go outside.
Okay. Okay. Yeah. From the examinations finding, I think you're having some yeah fracture of your clavicle. Okay, so that's why when I examine it it's like very painful. Okay, and they're like showing some deformity over the shoulder. Okay, sorry, over the, yeah, clavicular area. And when I examine your hand also, the shoulder joint, it's also painful, and you want me to let any examination because of the pain. Okay, so yeah, so altogether, yeah, I think there are some like fractures of the clavicle that adversely affects the ligaments of the shoulder. Okay, so the ligaments will help to bind the
Time up.
like clavicle to the shoulder. Yeah, so
Time.
that's
Time
why
up.
I think we're having these things. Okay, thank you.
If you finish reading this one, ask me. I will change into other page.
Okay. Yeah, yeah, please turn the page. Oh yes.
Hi, doctor. Can I check your ID?
Yes.
So this is your patient Ben. You can start.
Okay, dear examiner, I have a look at the fluid chart and vital chart. So on the fluid chart, um, yes, I think there are some like imbalance of the fluid because the intake is, I think, 4 liters and output is only 1000 ml. So if it's any fluid running, so I would like to stop the fluid now. And regarding the vital chart, as the patient is having some shortness of breath and saturation is also low, so I'd like to put the patient to the resuscitation cubicle and attach to the monitor and give her some oxygen. Uh, okay, yes, and okay. Yeah, so I would like to examine the patients. So first of all, I would like to see the general appearance. So is my patient is in distress right now?
Patient is in respiratory distress, but as you have put him on oxygen, he feels comfortable now.
Okay, and is there any pale or any jaundice, any
No pallor, no
dehydration?
jaundice, no
Okay, no
dehydration.
cyanosis? Okay, and I would like to know the vital signs again after putting the monitor. Yeah.
So patient's vital signs are all stable at the moment.
Okay, I would like to do hereditary examinations, but more focused with the respiratory examination first. So on the
Yeah,
respiratory examination, is the air entry equal and chest expansion?
there is a reduced air entry on the both lung bases.
Okay, and is there any on auscultation? Is there any adventitious sound?
There is bilateral basal crepitation,
Okay, and on percussion, is there any dullness?
dullness in the both bases.
Okay, and I would like to do the Cvs examination. So, is there any raised JVP, any carotid bruit?
There is no carotid bruit, but there is raised GBP.
Okay, and is there any like apex beat palpable?
Palpable.
On auscultation, heart sound 1 and 2 is audible or not?
Yes, there is S1, S2 audible.
Is there any gallop rhythm?
There is S3 gallo positive.
Okay, any added murmur apart from this?
No murmur.
Okay, and I would like to do abdominal examination. So on inspection, is the abdomen distended?
No.
On palpation, is there any hepatomegaly or any hepatic tenderness?
No hepatomegaly or no tenderness.
Any of ascites present, like fluid shift or anything?
No ascites.
Okay, and okay. So is there any neurological examination available?
Normal.
Any office test available? Urine depistic test, blood sugar level.
Normal.
Any X-ray available?
No.
Any ECG?
No.
Okay, so thank you, examiner. Um, okay, I have examined you and I have taken your history. Okay, so most possibly when I examine your chest, there is some finding. Okay, so that what we suspected, like you are having a conditions that we call like congestive heart failure. Okay, are you know what is it?
No, doctor. What is that?
Okay, so as you are having some like high blood pressure in the past, okay, and after the operation, we have given some fluid to you. Okay, so we have given some certain amount of fluid, but you are not able to like take out this fluid from your pee. Okay, so there is some fluid imbalance over there. Okay, so that what happened, like in that condition your heart is not pumping properly. Okay, so there are some irregularities. Okay, so that's why there are some in like backflow pressure of your lungs. Okay, so that's why you are having this shortness of breath. Okay, in
Hmm.
advancedly we can call it like pulmonary edema. Okay, because there are some backflow of the fluid into the lungs and there are some swelling of the air passages over there. Okay, so
Yeah.
that's why you already having this like shortness of breath and everything. Okay, so we already like start managing your condition, like due to during the like shortness of breath we already give you the oxygen, and I already stopped the fluid because there is some fluid overload in your body. Okay, you
Yeah.
are having all these medications. Okay, but we need to put you some water pill. Okay, that will like help to get rid some of the water from your body. Okay, so we will use the diuretics for now on. Okay,
Yeah.
and as you are taking all this medication, so that's fine. So at the moment I have to call my register, and I will inform the cardiologist and the specialist to come and have a look on you. Okay, that sounds okay with you?
Yes, doctor.
Okay, don't worry, you are in a safe hand, and we will do all the things to save your life. And there would be due to other cause apart from this, it could be due to any respiratory problem like any lung issues, or it could be due to any problem with your liver. Okay, or it could be due to any problem with your like glands that we call like lymph nodes. Okay, yeah. So but it's unlikely from the history examinations findings. Okay, okay,
Yeah.
thank you.
Thank you. You have got 1 minute 20 seconds in your hand. If you want to continue anything, you can do, or you can go outside.
Okay. Hmm. Yes, we are monitoring your vitals and we will continuously giving you the oxygen. So when your oxygen level will be like goes up, then we will put off from the oxygen, and we will also do some investigations like blood investigations, like full blood examinations, inflammatory markers, all the things like electrolytes, everything, and we will also do a ECG. okay, to see your heart condition, because as I said, it's due to the heart problem. And we will, the specialist also might consider to do some ultrasound of the, or a scan of the heart, that we call echo, okay. And we can also do some chest x-ray to rule out the lung cause, okay, to see is there any positive finding over there or not, okay. So we have to do all the investigations, okay, to confirm our diagnosis, and we already put you on those medications, okay. Just we are waiting to come the specialist to come and have a look on your condition, okay. So I know that it's very
I'm not.
stressful to you, okay. Okay, thank you.
Hi, doctor. Can I check your ID?
Yes, this is Naidi.
So this is your the father of the patient. Father name is Mike. You can start.
Hi, Mike. I can understand that your son is having some breathing difficulties. Before we start, I want to make sure that your son is stable right now. So I want to ask
Mhm.
you more questions to my examiner. So please wait. So the examiner, is
Yeah.
my patient vitally stable to proceed?
Yes, proceed.
Okay. Yeah, Mike. Can you give your son name, please?
So my son name is John, doctor.
Okay, okay. So can you tell me about John's difficulty in breathing in more details? Like when did it start?
Yeah, doctor. So it's been started since this morning. He was not having like too much difficulty, but since this morning it's becoming like it's very hard to breathe.
Okay, I'm so sorry to hear that. Don't worry, but your son is in a safe hand now. Okay. So this morning. So is it start suddenly?
Yeah.
Okay. And have you noticed any any noisy breathing or any rapid breathing?
No.
Okay. Does any time he stop breathing for a while?
No.
Okay. And like before the noisy before the difficulty in breathing, what was he do?
So he was having some infection, I think. So doctor given some antibiotic for that. So previously for the last 1 week, he had this cough and sputum, had some fever, and the
Hmm.
doctor gave some antibiotic. But I don't think it's acting. He's not getting better. He's getting worse.
Okay. And does your does the John has cough and fever right now?
Yeah.
Okay. So can you tell me more about the cough? Like what is the nature of the cough? It is dry or productive?
It's productive.
Okay. And is there any barking cough or honking cough?
No,
Okay. And does he cough and vomit?
no,
Okay. And how about does he turn pale or turn blue uh,
no,
while coughing?
no.
Okay. And how about is this for the first time? Does he is having this type of things?
Yes, doctor.
Any rash all over the body?
No,
Okay. And does he has any like drooling of saliva
no,
from the mouth? Okay. Does he take any posture to get rid of this cough and shortness of breath?
no,
Okay. Was he unsupervised for a while before he started difficulty in breathing?
no,
No. Okay. And how about does the John has any allergy to anything?
no,
Like does he has any paint, any carpets at home?
no,
Does anyone smokes at home?
no.
Does
Few minutes
anyone sit
over.
around? Okay. Um, okay. So I want to examine John. Okay. So the examiner, I want to do the respiratory examination.
Yes. What do you want to do?
Okay. On inspection, is there any scar, any swelling? I'd like to do the chest expansion.
There is no scaring. The chest movement is decreased on the left side.
Okay. And
Sorry, in the right side.
right side. Okay. And I would like to know do the percussion for is there any dullness?
There is dullness in the
Okay.
right bases.
Okay. And any auscultation is there any adventitious sound?
There is no adventitious sound, but there is like a decreased breath sound on the bases of the right lung.
Okay. Any wheezes, any rhonchi crackles?
No wheezes, no rhonchi.
Okay. Any intercostal or subcostal recession?
Yes,
Any accessory muscle use?
yes,
Okay. Any respiratory sign like any nasal flaring, any gardening, any tracheal tag, anything?
no,
Okay. So I would like to, okay, no, like, is there any X-ray available?
yes. This is the X-ray.
Mm, okay. Okay. So thank you, examiner. So what is okay? Yeah, Mike, I have examined John and I have taken history and we did some X-ray. So this is the X-ray, okay, of your son. So you can see on the X-ray, let's see it together. So this is the like whitish part you can see here. It's the bone, okay. So in the middle of this is the like windpipe, okay, and you can see over the black shadow, so this is the lungs, so here indicate black, okay. So you can see here the left side it looks normal, but it's on the right side you can see here, okay. So there are some the lung size is like bit small, okay. And you can see here there are some on the side of the lung and on the lower side the like you can see compared to the other side the edges is bit blunt, okay. So we can tell that there are some like accumulation of fluid over there, okay. So maybe it's due to some infection, okay, because your baby is having a fever, cough, and also now he is having some shortness of breath, okay. So that's why I am thinking of some infection of your baby's lung, okay. So these infections yeah, so okay. So this can these infections like accumulate some fluid over there, so that we call the pulmonary embolism, okay. And it could be due to some infections over the lung that we call like pneumonia, okay, or it is infections by the bug, okay, or it could be due to infections by the virus, that we call like bronchiolitis or croup or epiglottitis, okay, that will infect the lining of the lungs and also the like windpipe, voice box, this type of things, okay. So in that case we baby may have some like barking cough or drooning of saliva, but it's unlikely from the history, okay. Or it could be due to any other cause, like we call the pertussis. It could be due to infections from the bug that also damage the lung lining, okay. So in that case your baby may have some like cough and vomit, and like cough is for like greater than this duration, okay, but again it's unlikely, okay. And you tell me that the shortness of breath starts suddenly, so it could be due to any inhalation of the foreign body, okay, but it's again it's unlikely. Or it could be due to any allergic conditions that we call asthma,
Time up.
that also damage the air passage, okay. Yeah.
5 minute break. All right, so next session. Now, for this station, I'm pausing just for you. So for this station, you need to have a medication chart in your laptop. I asked it to be with you at that time. So can you please make sure that you have a medication chart on your laptop, and also just write it on your paper that how you are going to write it in the exam. Do you have anything like that in your side?
Yes, I have. Yeah,
Okay,
my
good.
meditation chart.
So all right. Okay, so I'm just resuming your time again.
Okay, I have copied the chart on my paper. So I have copied
Yeah,
only one chart. So yeah, I can. Okay.
that should be fine. Yeah,
Yeah. Okay.
if yeah. Hi, doctor. Can I check your ID?
Yes.
So this is your patient. Your patient is name is Jenny Gardner. So you can start your station. The means book has been given. If you need to look at it, just let me know.
Mm,
Thank you. You can start.
okay. Thank you.
You have given a memes book. If you want to use that, let me know.
Okay. Yeah.
If you want to go to the next page, also let me know.
Yes. Yes. Yeah, I have done.
All right. So I think you have 50 seconds in your hand. So do you want to, do you have any things to upload what you have done in here, or you can send me to my email also when you finish your exam?
Okay, I will send you, yeah, to your email.
All right. Okay. All right. Time up. Next station. Hi, doctor. Can I check your ID, please?
Yes.
This is your patient. Your patient name is Anna. You can start.
Hi, Anna. I'm Dr. Anika, one of the GP in this clinic. So, how can I help you today?
Doctor, I'm having this change in my color of the urine for the last 2 to 3 weeks, and I think it's getting worse. So that's why I just thought like it's a good idea to just talk with you.
Okay, you did a great job to come here. Okay. So, can you tell me more about this dark urine? Like, what you exactly mean this dark urine? Like, what exactly is the color?
It's kind of like a straw color, I would say.
Okay. Have you noticed any blood on it?
No,
Okay. Is the dark urine like throughout your urination or at the end or at the beginning?
it's throughout.
Okay. And regarding your urination, do you have any pain during pee or any burning sensation?
No, no.
Okay. Any pain in your tummy?
I feel some dragging sensation in my upper part of the tummy.
Okay. Which side?
It's in the just in the center of my upper part of the tummy.
Okay. And does it goes anywhere else?
No,
And is it like continuous or on and off?
it's on and off.
On and off. Have you noticed any heaviness?
No,
Okay. And anything make it worse or anything make it better?
no.
Okay. And did anyone notice that you are like look bit yellowish nowadays, like your eyes, your skin?
Yeah, my partner said that I look little yellowish.
Okay. And do you have any fever, any rash,
No,
any itchiness over your body?
no.
No. Okay. And how about uh, do you have any recent travel history?
Yeah, doctor. I recently traveled. Yeah,
Okay. Why do you travel?
I traveled to Indonesia.
Okay. And have you like got there any tattooing or any body piercing over there?
No.
Okay. And how about have you noticed any unwanted weight loss or loss of appetite?
Yeah, I feel like not eating for a couple of weeks, and I think yeah, I'm losing weight.
Okay. How many kilos in over how months? Yeah, how many
I
months?
I lost like about 6 kilo in last 3 weeks.
Okay. And how about are you eating any like fatty meals like fast food, any fatty foods?
No.
Okay. And how's your health in general?
Yeah, apart from it, I was pretty healthy so far.
Okay. Do you had any past history of any surgery, especially in your tummy, or any medical
Yeah,
condition?
I had my gallbladder removed 2 years ago.
2 years ago. Okay. After that, do you had any complications so far?
No,
Okay. Do you smoke or do you drink alcohol?
no.
Okay. And are you able to check your health with your GP?
Yeah.
Okay. So I want to examine you. Okay. So please bear with me. So to examine, I may have the general appearance. So I'm looking for any jaundice.
There is icterus or jaundice positive.
Okay. Any rash, any lymphadenopathy,
No,
any scratch mark all over the body.
no.
Okay, and I'd like to do head-to-toe examinations, but more focused on the abdomen. So on abdomen examination, on inspection, is there any scar mark, any swelling? Uh,
No,
okay, any scar mark, or sorry,
no,
any scratch mark or any distension?
no. Abdominal examination is normal.
Okay, on okay, is the abdomen soft, non-tender, any masses, any organomegaly?
No,
Okay, and may I have the BMI of my patient?
BMI is 18.
18. Okay. And is any office test available, like urine deep stick test?
Yes, what do you want to know from urine dipstick?
Bilirubin, your
Yes, there is
bilinogen.
3 plus bilirubin.
Okay. And any RBC.
Nope.
Okay. Any ultrasound of tummy, no, abdomen.
No. No.
Okay. So thank you, examiner. So yeah. So look, from the history and examinations finding, I think what you are having we call is post cholecystectomy syndrome. Okay. So do you have any idea what is it?
No.
So you are having this like when after gallbladder remove, you are having this dark urine and jaundice. It's all symptoms of this like due to this gallbladder. But what happened when the gallbladder remove the bile that helps to digest the fat? It's like not draining properly, and it's like there are some obstructions or there are some I think sorry, but I don't mean to scare you. I think there are some like nasty growth over your tummy. Okay, so are you with me so far?
Why? How do you think that just within 3 weeks I have a cancer? You saying?
No, it's only my working diagnosis because you have loosened some weight and you're also having some darkish too. So I think there is some obstruction over there. So we can call it like cholangiocarcinoma. So there are some like drainage, like the bile tube. Okay, so I think over there is some obstruction, but don't worry, it's only my working diagnosis. We have to do further investigations. Okay,
Mm.
and it could be due to any other cause like inflammations of that area like the bile tube that we call cholangitis. Okay, but it doesn't have any fever or any itchiness, so it's unlikely. Or it could be due to any yeah, any narrowing or any we call it stricture over there. Okay, or it could be due to any stone over that tube. Okay, but it's again maybe it's unlikely from the history. Or it could be due to any inflammations over your other organ that would is like liver that we call hepatitis. Okay, but you doesn't have any like tattooing or body piercing or any fever, so it's unlikely. Or it could be due to any nasty growth over the liver that you call hepatic carcinoma, or any nasty growth over your like all of the one of the organ we call it pancreas. Okay, that helps to digest food. Okay, but it's unlikely because you doesn't have any like alcohol intake or anything. Okay, so it's unlikely from that. Okay, so don't worry, we have to do further investigations, and whatever there, we are here to help you in the best possible way. So don't be too scared.
Right.
Okay. Okay. Thank you.
Hi, doctor. Can I check your ID?
Yes, please.
So this is the patient's daughter is here with you. Her name is Jennifer. You can start.
Okay. Hi, Jennifer. I'm Dr. Janika. I will be your GP today. So before we start, I want to make sure that you have the power of attorney to talk regarding your father.
Yes,
So
doctor. I
they
have the
can.
power. Continue.
Okay. So yes, Jenny. I can understand that your father is being confused for nowadays, right? And
Yes.
he's had lots of health issues. Okay. So we had taken some history and we also did some investigations. So the investigations results are with me right now. So I want to explain the results to you. Okay. So so whenever you haven't like didn't get anything, then you can please tell me. I will explain it to you again. Okay. So basically, we have do some electrolytes that we call like salts in our bloods. Okay, because these salts are very important, and when it's there is any imbalance, it can cause like confusion or anything. Okay, so here you can see we have done some salt investigation. So one of the salt we have done 3 or 4 salts. Okay, so one of the salt we call it like sodium. Okay, you can see here. So it should be like 135 to 145, but in your father case it's only 120. Okay, so it's bit reduced. So I think that's why your father is having this like confusion. Okay, and the other salt we call it potassium, so it's in the borderline, like it could be 3.5 to 5, but 5.5, but it is only 3.5. Okay, and rest of the thing like we already check the kidney and all the bloods, because your father is having some chronic kidney issues. So so far now it's normal, the kidney, the renal function test like creatinine urea is normal. So only we get from the results is there is some like salt imbalance that we call electric imbalance, most probably the sodium. So these conditions we call it like hyponatremia. Okay, so are you following me so far?
Yes, doctor.
Okay. So this confusional state we called it like delirium, acute delirium or acute confusional state. Okay, so there are some lots of cause of this condition, but in your father case is most probably the electrolyte imbalance due to hyponatremia. Okay, and regarding this, like this sort imbalance can cause changes or alter in some function in the brain, so that's why your daddy has some behavioral changes. Okay, or it could be due to any other cause, like if your father has any infection in the chest, or if your father has any infection anywhere else in the body, like in the blood, in the urine, that can also cause these symptoms. Or it can be due to any lack of oxygen in the like blood and in the brain also, so we call it hypoxia, so that can also cause this symptom. And it could be due to any other cause, like if he is taking medications. Okay, that like too much medication can also alter this conscious level. Okay, and it can be due to any other like medical conditions, or like your father is having like diabetes, heart issues, pressure issues, so that can also adversely cause this type of things when any complication happen. Okay, or it could be due to any other hormonal imbalance like thyroid or other hormonal things. Okay, so far we haven't find any positive things apart from this hyponatremia. Okay, so what we gonna do now, we have to admit your father. So we are in a GP center. Okay, so no, okay, yeah, nursing home. So at the nursing home, so your father will be looked after by a, like one shift nurse. Okay, like there will be like calm environment needed for your father. Okay, like most familiar things, so he can be surrounded by familiar faces like you, his friends, so then he will be feel better. Okay. And we already done some investigations, so we can do further investigations like further blood investigations. We can also check the heart by doing ECG, lung by doing X-ray, or we can also do some test that we call like delirium screening test. Okay. And after that, as your father is like sodium level is low, so we can put her on some fluid that is filled of sodium. Okay. That will help her to give him some relief of the symptoms. Okay. And after the investigations, all the investigations, if anything came out positive, then we will treat him accordingly to that. Okay. And are you following me so far?
Yes, doctor.
Okay. Okay. And there will be like a doctor to and monitor your father's conditions and your father's vitals like blood pressure, pulse, temperatures. Everything will be monitored over there. Okay. And yeah, and if your father like has some difficulty to sleep, then we can something give her to put him to sleep. Okay. So yeah, for right now we can do these things, and we can see how these things improve your father's condition so far. Okay. So yeah, do you have any question?
So, doctor, like, my father can be in the nursing home at the moment, right?
Yes, your father can be in the nursing home in the at the moment, because your father is confused, and it's best to has some like familiar faces and familiar things around your father. Then your father will be feel better and more comfortable. Okay. And we can treat your father conditions over there. Okay. Because there has some facilities. Okay. And there will be only one nurse to look after your father. Okay. Because if your father see too many strange faces, then your father condition can get worse. Okay.
Okay.
Okay, thank you.
Thank you. So you have 30 seconds in your hand, so you can talk more, or you can go outside.
Okay. Okay, so don't worry about your father conditions. We are here to help you in the best possible way. Okay. And we will doing our best. Okay. And your father can take those medications for the health that he is taking. Okay. At the same time, at same dose. Okay. And we will keep monitoring your father condition.
Emma? So this station is your last station, and in here, whenever you want to go down, just ask me. I will go down to the other base. Start.
Yeah, other page, please. Yes, other page.
Uh, yeah, this is the last one. Hi, doctor. Can I check your ID?
Yes.
So this is the station. You have got 4 minutes time before you call, if you before you call the register on the phone. Okay. So, and after 4 minutes, there will be a beeping, and you can start.
Okay.
If you want to see the other part, then you can ask me to go to any of the page.
Yes, I want to see the other parts from the beginning. Yeah. Can you please go down? Can you please go down? Yeah, I have to start now.
Just got few seconds left. So you've got the phone call with Dr. Adam. You can give a call to Dr. Adam now.
Uh, Hello, is this Dr. Adam?
Yes, I'm Dr. Adam, who I'm talking with.
Yes, Dr. Adam. I am one of the medical officer here working in a Princess Alexandria Hospital. My name is Dr. Anika. So I'm calling
Yes, doctor.
regarding one of my patient. Uh, Her name is Sarah. So she came yesterday in the ED with the complaint of fever and swelling and some tummy pain because she had an operation like appendicectomy 1 week ago. So I think which was got infected, and after that we have done all the investigations. like inflammatory markers, and we will treat her condition with antibiotics like amoxicillin, ceftriaxone, and metronidazole. And after that, her condition settled. I think after the medication, like today, the nurse called me and she noticed that there are some rashes all over her body, and there are some also like this rash is also very itchy, and she also feels some like nausea, vomiting, and she has some shortness of breath, like wheezing and chest pain also. Okay. And when I took the history, I asked about any allergic to any medication. So she was unsure, but she has a like family history of some allergic condition and some breast cancer and heart issues. And she also had some past history of like depression, OCD, asthma, eczema, high fever. So that's why she is taking some medication to control that, and she is regular with the medications and regular with her GP also. Um, after that, taking the history and everything, I have examined. I did some examination on her. So on examination, there are some erythematous maculopapular rash. I found it. So it extended from the trunk to the limb, and it was like very itchy, and the vital signs are normal regarding during my examinations, including the temperature, and when I examine the lip and tongue, it's not swollen, and rest of the examination was normal, like especially the respiratory examination. I haven't found any wheeze or anything, so it's all normal. So after that, we stopped the medication because we are suspecting like some allergic reaction due to that. So now I'm calling regarding this patient. So I want you to come here and see Sarah, because she is having some severe like allergic reaction. What should I do now?
Yeah, yeah, that's all right. So, do you think like this patient is having any anaphylaxis or anything like that?
Yes. I think patient is having anaphylaxis, and she's having some hives, like some rashes.
Okay, all right, I'll be there. No worries, thank you.
Okay, thank you.
All right, so your time is up. All right, so this was all about our today's station. So, how does it feel? I think you should be really tired.
Yes.
Yeah, yeah, I'm also feeling really tired. Like after a long time, I've taken like these 16 stations. Okay,
Yeah.
so all right. So, how do you
Okay.
think that how's your examination?
I think it was not good. Some of the station like headache. I totally miss the headache station all the time.
No,
Like
you
the
did
headache thing.
wonderful. I think yeah. No,
No.
in my perspective, you did really good. And like what understand from the 16 station that you have a very good idea on most of these cases, and so you are very much ready to appear the exam. So
Okay.
what you just need to do some more, just some revision I think will be needed. So
Okay.
just do some revision of all those questions that you have been doing. Do some more role plays. That should be fine. And try not to miss the diagnosis, because we will discuss that in one of the feedback sessions. But
Okay.
you did really great. But some of the things we will discuss that if you
Mm-hmm.
do that, then it will be more good. So in that way, we can do that. But otherwise, I think overall, yeah, that's really perfect. But yeah, and what I need you to do, send me that medication chart that you have done to my email.
Okay.
It's I'm writing it in your chat box. It's first aid AMC 4536 at outlook.com. Right, so send it today. I'll have a look to the all the stations, and then we'll give you a feedback.
Okay.
Now, feedback will be for all the participants. I guess like many people were here, about more than 100 were here today. So we'll give a short feedback. It will not be possible to discuss all these 16 stations like in detail. We'll just
Mhm.
give a feedback like what Dr. Anika has missed and what she can do to improve that. But we'll not discuss it like a case by case. It's just a formal feedback we will give it to her. That should be
Oh,
fine.
yeah.
Okay.
Yeah. Okay. Thank
Yeah,
you.
good luck
Thank you
for
very much.
everyone. Yeah, thank you so much,
Okay.
Dr. Anika. It was really nice that you did really perfect that how I wanted. You did in that way, so that's good. Okay, so we'll have a time for the feedback session in this week. I will give you an update in the group. Keep an eye, and thank you all for joining the session. Anyone has any question in regarding to the today's session? And also for you guys information, you guys know that our session, the 5 months clinical session is gonna start from 30th October. So we'll have it 2 weeks free sessions for everyone. More than welcome to join those session and see how the classes are. And then if you want, and you can join the 5 month session after the 2 weeks. The class will be live on the Zoom and also in the Facebook. So Zoom ID is already given for those classes and also the schedule is given. So just keep an eye on those in the group. You'll be having a good time. I hope so. All right. So feedback session, Dr. Tani, I haven't thought about it the exact time. I will see my schedule today and give a date. Probably it's going to happen on Friday. He's very good. How to contact you for any doubts by email or Facebook? Try to send a message in my messenger in the Facebook. That's more faster way. Or if you want, you can also send an email to me. Isbar case, we will discuss it in the feedback session. The memes is mainly, it's a book which contain all the medications, the doses and everything. They will give you a book over there and you just need to see. The information will be just like how I have shown it to you. All the information of that particular medication will be given in that book. I don't have that book with me. It's because I have it online, so I don't use it as a book. So that's why I don't have that. And the paid mock exam, we take mock exam individually. That's 150 Australian dollar for 16 stations. All right. So that's everything for today. I'll just have a look in the Facebook. Those people are in the Facebook. Do you guys have any question on Facebook? Yes, Dr. Romisa Irfan. We will discuss those things in our classes. That yeah, giving some painkiller, those are important. Yes, clavicular fracture, we need to give a painkiller. And PE station, we will discuss. There will be no recording, but already this is in your Facebook group, so you'll be able to see this in the Facebook. Or if needed, we can like join the both feedback session and this session together and make a video for that. That will be more helpful. We cannot make a direct diagnosis of cholangiocarcinoma, but yeah, we can give the differential diagnosis. No, Dr. Sarah Mati, it was not a 19 performance station. The last station was a rest station. That's why we did not take that. It's a 20 stations. Okay, so that's all I think. Thank you all for joining the session. Oh, all right, Dr. Kuku. So, Dr. Cookie, sorry. So, what is the invigilator? The invigilator is just like an examiner, but they don't mark you. They help you. They give you the positive findings and everything. So, normally when we do the face-to-face exam, the examiner did this function. Now there is no examiner. The invigilator will give you all the findings. uh, Dr. Saji, the paid mock test, you can, whenever you want to take the paid mock test, you can email us and then we can give you a time schedule and then you can pick up your favorite time. Okay. But there is no time schedule for paid mock test. It's individual. So anyone wants to take the test, you need to send us an email. Medication chart, we discuss it in our course. Okay, it will be difficult to discuss in the feedback session because it's a long thing to discuss. We will go through how Dr. Anika has done and then we'll see if it's correct or not. Yeah, Dr. Hafsa, you can say most likely nasty growth, and that would be obviously the nasty growth. We will discuss those things, Dr. Farhana, that delirium workup and everything. Don't worry on that. So there are a couple of things we need to discuss about those cases. Okay. That's great. So thank you all for joining the session. We'll have a feedback session. If you guys have any questions about these cages, you can ask at that time. Okay. So have a good afternoon and evening and have a good night also. Thank you all. Bye. And thank you, Dr. Anika. You did great.